Welcome, everyone, and thank you for standing by. At this time, I'd like to inform all participants that your lines will be in a listen-only mode for the duration of today's conference call. Today's conference is being recorded. If you have any objections, you may disconnect at this time. I will now turn the meeting over to our first speaker, Ms. Julie Fliss. Thank you. You may begin.
Webinar Facilitator, Julie Fliss.
Yes, hello, everyone. Thank you for joining us today for our webinar on child welfare worker safety in the time of COVID, CDC Recommendations for in-person interactions with families. I'm going to go through a little bit of housekeeping measures to make sure that you all are able to access all the information that we're going to talk through today. On the far right hand side of your screen, you'll see some best practices for Adobe Connect. One thing to consider is the browser that you're using. You will probably get the best experience if you can use Chrome, if you have access to that. If you have any problems connecting, another thing to consider is to clear your browser before you connect, and that may also help with your experience. And the other thing is to also consider closing applications. VPN is not required for Adobe Connect. And today we are going to be using the chat box. I can see it's very active already, which is excellent. We're getting hellos from across the nation. So we're really excited about everybody participating today. We are going to be using the chat box also for questions today. Everybody's line is muted. So please, as we go throughout the presentation, go ahead and put any questions that you may have in the chat screen. We are going to leave some time at the end of the webinar to do our best to answer the questions that we have. We will be recording them for our own information because we will be using this to better understand how we can consider to get this important information out to the field so that you can do all the wonderful work that you do in helping children and families. If you do find that you're hearing any feedback as you are listening via audio, please mute your computer speakers and use your phone to listen, or vice versa. If you have both going, the computer and the phone, it makes it a little more difficult for you, and that's an important piece. Again, we're not going to be using the audio, so you can be sure to dial in or use the chat box for that. The other thing that I do want to let you know, too, is underneath the chat box here, there is, it says files. There are two files available for download. One of them is the PowerPoint presentation that we'll be going through today, and the other are some select resources that the Center for Disease Control and Prevention and the Children's Bureau that we've identified. So please, you can go ahead and download. They are both available there. You can just click on them and download them. So I am going to go ahead and I have the great pleasure of introducing our Associate Commissioner with the Children's Bureau, Jerry Milner, who is going to give participants a welcome this afternoon or this morning, depending on where you are. Jerry?
Thank you so much, Julie. I do want to welcome all of our participants on the line today. As I'm looking at the number, we are well over 550 so far, and the number is going up. We really appreciate the interest in this topic and the time that you're given to participate with us. I also want to thank very much the Centers for Disease Control and Dr. Sager from Massachusetts for joining with us on this webinar today. And thanks so much to you, Julie, just for all the work that I know you put into making this happen. For the past 4 years in the Children's Bureau, we have had a very short list of major priorities that we have been focusing on. Many of you, no doubt, will be familiar with our priority on the primary prevention of child abuse and neglect, since that is what I believe we've been most visible and probably quite vocal about. But that very short list of priorities has included a focus on strengthening the well-being of our child welfare workforce as a major consideration as we move forward. We can't expect to keep families and children and young people healthy and address their well-being if we do not have a healthy workforce and are not committed to the workforce's being as well. Having carried a child welfare caseload myself in the field for a few years, I know personally the privilege and the responsibilities that go with trying to keep children safe and trying to keep entire families healthy and able to care for their children safely. I think it's safe to say, in my experience, that never has the need to support our workforce been more apparent than in the past few months, in which we nationally have suffered a tremendous crisis. Our child welfare staff out in the field, service providers, resource families, court personnel, are every day balancing the need to provide essential services to children and parents, balancing that with their own safety needs and the safety of their own families and children. And we're deeply grateful for that effort that we have been able to see across the country in this unprecedented time. From the Children's Bureau, we have certainly tried to offer as much flexibility and opportunity as possible in order to support the workforce by making, to the extent possible, virtual technology available to address critical operations, critical functions, trying to improve the access to personal protective equipment for folks who are out in the field interacting with other people every day, urging governors and child welfare agencies to have the child welfare workforce classified as level 1 emergency responders, other things, all in an effort to try to facilitate the work and keep our workforce safe and healthy. At the same time, we know that challenges do remain, and this webinar is yet another attempt to try to equip our workforce as best we can to continue the absolutely essential work that you're doing. I just want to end by commending and thanking our workforce for all that you're doing to ensure that children are safe and that parents receive the essential services in order to reunify, to maintain critical parent-child relationships. And also, I want to commend you for your efforts to take care of yourselves and your own families. I hope very much that today's call will be of some benefit as we continue on this journey and maintain critical protections for you and for children and families going forward. So thank you so much once again, and I'll turn this back over to you, Julie.
Great. Thank you, Jerry. I realize that I did not do a very good job of introducing myself, so I just want to say real quickly, my name is Julie Fliss. I'm going to be facilitating today's webinar, and I am a Child Welfare Program Specialist in the Children's Bureau in the Office on Child Abuse and Neglect. So it is my great pleasure now to introduce our next presenter, Jennifer E. Lincoln, who is a health scientist with the Centers for Disease Control and Prevention's National Institute for Occupational Safety and Health. Jennifer?
Thank you. As a former foster parent and adoptive parent, I understand what your workforce is going through, and I appreciate everything that you do to help the children of the United States. Today, I will be sharing guidance for child welfare workers and employers, drawn from general CDC guidance developed for businesses and employers that is available on the CDC website. Today, we will cover COVID-19 prevention and control, what child welfare employers should do, and what child welfare employees should do. As many of you know, this virus is thought to be spread mainly from person to person between people who are in close contact with each other within about 6 feet through respiratory droplets produced when an affected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly inhaled into the lungs. Everyday preventative actions for respiratory illnesses include avoiding touching your eyes, nose, and mouth with unwashed hands, avoiding close contact with others, especially those who are sick, staying at home as much as possible, especially when you are sick. When in public, wearing a cloth face covering that covers your nose and mouth, covering your cough or sneeze with a tissue, then throwing it away, washing your hands often with soap and water for at least 20 seconds, and using an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. There are no specific antiviral treatments licensed for COVID-19 currently. Treatment currently includes supportive care to relieve symptoms and managing pneumonia and respiratory failure.
An additional preventative action is to clean and disinfect frequently touched objects and surfaces.
Our first focus is social distancing, also called physical distancing. You're maintaining 6 feet of space between yourself and others while working, obtaining services, and recreating, and staying at home if you're sick or exposed to someone who is sick. This can help slow the ongoing spread of the respiratory illness and COVID-19. Social distancing community measures can include postponing or canceling mass gatherings, dismissing of schools, and encouraging telework. And as I go through these slides, you'll see links to the information on our CDC website, and there'll be hyperlinks to some of the text specifically that will bring you to the information you find on the slide.
More information on social distancing can be found on the CDC website at
https://www.cdc.gov/coronavirus/2019-CV/prevent-getting-sick/social-distancing.html.
The CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, for example, grocery stores and pharmacies, especially in areas of significant community-based transmission. Cloth face coverings can help people who may have the virus and do not know it from spreading it to others. A significant portion of individuals with coronavirus lack symptoms or asymptomatic. And even those who eventually develop symptoms or are pre-symptomatic can transmit the virus before knowing they have symptoms. The virus can spread between people interacting in close proximity through coughing, sneezing, singing, or forcibly speaking. Wearing cloth face coverings may be difficult for individuals with physical, sensory, cognitive, or behavioral impairments and is not recommended for children under the age of 2 or anyone who is having trouble breathing, is unconscious, incapacitated, or otherwise unable to remove a cloth face covering without assistance.
An infographic shows the do's and don'ts of cloth face coverings. In the cloth face covering do list, make sure you can breathe through it. Wear it whenever going out in public. Make sure it covers your nose and mouth. And wash after using. In the don't list, don't use it on children under age 2, and don't use surgical masks or other personal protective equipment, PPEs, intended for healthcare workers. More information on cloth face coverings can be found on the CDC website at https://www.cdc.gov/coronavirus/2019-sick/DIY-cloth-face-coverings.html.
Cloth face coverings should fit snugly but comfortably across the face. Be secured with air loops, include multiple layers of fabric, allow for breathing without restriction, be able to be laundered and machine dried without damage or change of shape, should not be worn again by individuals who have trouble breathing or unconscious or incapable of otherwise removing the mask. Cloth face coverings should be washed after each use. Cloth face coverings can be washed by hand or with your regular laundry on the warmest possible setting for that material. Child welfare agencies should ensure that their employees know to notify their supervisor and stay at home if they have symptoms, which include fever, cough, shortness of breath, chills, muscle pain, sore throat, new loss of taste or smell. Child welfare agencies should make a plan to communicate with the employees what they should do if they become sick while they're at work. Employees should seek medical care quickly if they have emergency signs such as trouble breathing, persistent pain in the chest, new confusion, bluish lips, or face. Most people will recover without needing medical care. You need to stay at home, away from people as much as possible. Wear a cloth face covering over your nose and mouth if you are around other people, even if you're at home. Keep your distance and cover your coughs and sneezes if you must be around people. Clean your hands often. Avoid sharing personal household items. Clean and disinfect frequently touched objects and surfaces. And monitor your symptoms for emergency warning signs, including trouble breathing. Child welfare agencies and employees should follow CDC guidance for returning to work and follow CDC precautions for employees with sick family members. If an employee is confirmed to have COVID-19, an employer should notify fellow employees of the possible exposure while maintaining confidentiality.
Seek medical care quickly if you have emergency warning signs such as trouble breathing, persistent pain or pressure in the chest, new confusion or are not able to be woken, and bluish lips or face. Additional information on this topic can be found on the CDC website at https://www.cdc.gov/coronavirus/2019-if-u-r-sick/steps-when-sick.html.
People with COVID-19 who have symptoms and were directed to care for themselves at home may discontinue isolation under the following conditions. Using the symptoms-based strategy, at least 3 days or 72 hours have passed since resolution of fever without using fever-reducing medications and improvement of respiratory systems, and at least 10 days have passed since the symptoms first appeared. And using a test-based strategy, you follow the same resolution of fever without using fever-reducing medications and improvement of respiratory systems, and you have 2 negative FDA-authorized COVID-19 molecular assays for detection of COVID-19 for at least 2 consecutive specimens more than 24 hours apart.
Additional information on this topic can be found on the CDC website at https://www.cdc.gov/coronavirus/2019-HCP/disposition-in-homes-patients.html.
CDC has developed several recommendations for employers. We've developed a workplace reopening decision tool, and if you're considering reopening, which I know many of you are currently operating, you need to answer the following questions. Have you met the criteria? Are they consistent with state and local orders? And are you ready to protect your employees with higher risk of severe illness? Are the recommended health and safety actions in place? Can you promote healthy hygiene practices such as hand washing, cloth face coverings, intensifying cleaning, disinfection, and ventilation? Can you encourage social distancing and enhance spacing between your employees through physical barriers, changing workout layout spaces, encouraging telework, limiting access to communal spaces, staggering work shifts and breaks, and limiting large events? And have you trained all your employees on the health and safety protocols? Is there ongoing monitoring in place? Have you developed and implemented procedures to check for signs and symptoms of an employee upon arrival daily? Do you encourage anyone who is sick to stay at home? And do you have a plan if an employee gets sick at work? And in planning to resume operations, regularly communicate and monitor developments with local authorities and employees. Be ready to monitor employee absences, have flexible leave policies and practices in place, and be ready to consult with local health authorities if there are cases in the facility or an increase in cases in the area.
The CDC COVID-19 Workplace Reopening Decision Tool can be found online at https://www.cdc.gov/coronavirus/2019-CV/community/organizations/workplace-tool.html.
After you've conducted your assessment, we recommend that you designate a safety officer or someone who is responsible for responding to COVID-19 concerns at every job site. Workers should know who that person is and how to contact them. We recommend agencies to reach out to local public health officials to establish ongoing communications to facilitate access to relevant information before and during local outbreaks. This is important to recognize that some employees may be at higher risk of illness, such as those who are over the age of 65, those with lung diseases including asthma, and those who are obese. We encourage special considerations for these workers, flexible sick leave and supportive policies and practices, including non-punitive sick leave policies if sick leave is not offered. We also encourage that companies remind employees about the need for adequate sleep, which is important for their safety and their body's ability to fight off illnesses. We encourage employers to notify coworkers of positive cases and assist local health departments with staff with contact tracing.
Additional information on this topic can be found on the CDC website at https://www.cdc.gov/coronavirus/2019-CV/need-extra-precautions/index.html and https://www.cdc.gov/coronavirus/2019-HIV/open-america/contact-tracing/index.html.
Child welfare agencies can protect their workers by communicating regularly, and they need to communicate with the families that those workers serve as well about the mitigation and risks strategies, as communication is critically important. You should provide accurate information about COVID-19, how it spreads, risk of exposure, and proper hand hygiene. You should consider implementing a hotline for employees to voice their concerns and encourage employees to ask questions about the guidance, policies, and practices. Some solutions agencies can implement include social distancing, providing paperless documentation, which was mentioned earlier, implement options for virtual meetings and trainings, train employees on proper hand washing practices, preventive measures, proper disinfection practices for vehicles and other surfaces, safe child transport, safe residence entry, safe meetings, and provide employees with PPE, disinfection supplies, disposable disinfectant wipes, cleaner, and spray with paper towels. Child welfare agencies can hold safe meetings by conducting them virtually. You need to consider whether or not you should halt or alter groups or visitation activities. If face-to-face meetings need to occur, ensure that the meeting facilities follow the CDC safety practices such as social distancing, screening children and families, wearing face coverings, limiting the number of families at facilities, and cleaning and disinfecting regularly.
Additional information on this topic can be found on the CDC website at https://www.cdc.gov/coronavirus/2019-CV/guidance-business-response.html.
Child welfare agencies' employees should clean and disinfect frequently touched surfaces, including areas of break rooms, meeting rooms, toys and games, playground equipment, rest areas, sink handles, door and refrigerator handles, light switches, chairs, keyboards, mouse, and other common areas. And notify cleaners and maintenance workers when a suspected or confirmed COVID-19 individual was on site. Limited studies have led to concerns about the persistence of COVID-19 on environmental surfaces. For example, the RNA could be detected up to 3 hours in an aerosol, 4 hours on copper, 24 hours on cardboard, and up to 2 to 3 days on stainless steel or plastic.
Additional information on this topic can be found on the CDC website at https://www.cdc.gov/2019-CoV/disinfecting-building-facility.html.
Child welfare agencies should ensure that children's toys that have been placed in children's mouths or otherwise contaminated by body secretions or accretions should be cleaned and disinfected. Do not share toys with other groups or infants or toddlers unless they have been washed and sanitized before being moved from one group to another. Set aside the toys that need to be cleaned. Children's books, like other paper-based materials such as mail and envelopes, are not considered high risk for transmission and do not need additional cleaning or disinfection procedures.
Additional information on this topic can be found on the CDC website at https://www.cdc.gov/coronavirus/2019-FIN-COV/guidance-for-childcare/schools-for-childcare.html.
Child welfare agencies should ensure that vehicles or frequently touched surfaces are cleaned and disinfected after transporting children, including surfaces such as car keys, steering wheels, windows, driver and passenger door handles, turn signals, wiper controls, vehicles' dashboards, touch screens, temperature controls, and other touch surfaces. And to provide drivers with disposable disinfectant wipes, alcohol-based hand sanitizers, tissues, and a disposable tissue receptacles for the vehicles.
Additional information on this topic can be found on the CDC website at https://www.cdc.gov/community/organizations/disinfecting-transport-vehicles.html.
So what can employees do? Child welfare workers have a variety of situations when they may be exposed to COVID-19. Potential sources include having close contact with coworkers, contact with children and families, therapists and doctors, others on the child welfare team, court staff, and law enforcement, or contacting surfaces that may be touched or handled by someone with COVID-19 and then touching their eyes, nose, or mouth. Child welfare workers can ensure safe residency entrance for visitation or other things through the following methods. Meet outside if possible. Before entering the residence for work, conduct a COVID-19 awareness pre-entry assessment and ask if anyone in the building has been diagnosed or has symptoms for COVID-19. Inform all your occupants that you will be practicing social distancing. Ensure that everyone wears a cloth face covering. Your cloth face covering should be put on outside of the home prior to entry. If pets are present, ask the homeowners to move the pet to another area of the building. Wear cloth face coverings and gloves when handling items like clothing, medicines, and toys, and practice good hand hygiene. When transporting children that do not have COVID-19 or symptoms, practice social distancing. Wear a cloth face covering. Ask the children to wear a cloth face covering unless the child is having trouble breathing, cannot remove their face mask on their own without assistance, or under the age of 2. Seat the children furthest from the driver and practice good hand hygiene. Avoid using the recirculated air option on the vehicle ventilation system during transport, and instead use the vents to bring in fresh air from outside and lower the rear windows. Child welfare workers can ensure safe meetings and appointments by meeting virtually where possible, by screening children and families in advance, practicing social distancing, wearing cloth face coverings, limiting the number of children and family members at the meetings, and practicing good hand hygiene. And follow the COVID-19 safety guidelines given by doctors' offices and state and local offices.
Additional information on this topic can be found on the CDC website at https://www.cdc.gov/coronavirus/2019-community/guidance-business-response.html.
I know there are some cases where you do have to transport a child that has COVID-19. Child welfare workers can ensure safe COVID-19 contact through the following methods. First, you can identify non-emergency medical transport options for children with known or suspected COVID-19. If that's not an option, then follow the following guidelines. If you feel unsafe, contact your employer to discuss your concerns. Wear an N95 respirator or a face mask if a respirator is not available, and eye protection such as a face shield or goggles, as long as they do not create a driving hazard. And the child should also wear the cloth face covering unless they have trouble breathing or the previous things we've mentioned. You need to wear your N95 and eye protection before contacting the child with suspected or confirmed COVID-19. If you must provide any sort of assistance to the sick child, you should also wear a gown or other cloth covering and gloves that can be removed afterwards. Ensure the child over the age of 2 wears the cloth face covering unless they have trouble breathing. Use larger vehicles such as vans to avoid or limit contact within 6 feet. Again, avoid using the recirculated air option and lower your windows. Practice regular hand hygiene. Avoid touching your nose, mouth, or eyes, and avoid picking up multiple passengers unless they would otherwise be riding together. After transporting the child, clean and disinfect the vehicle, then remove your N95, eye protection, gown, and gloves, and clean your hands. Follow the standard operating procedures for contaminated PPE and disposal of used PPE. After the work shift, launder the work clothes worn when transporting the child.
Additional information on this topic can be found on the CDC website at https://www.cdc.gov/community/organizations/disinfecting-vehicles.html.
So in summary, we recommend that child welfare agencies communicate to their employees on how they can protect themselves by limiting close contact, wearing cloth face coverings if social distancing is not possible, practicing regular hand hygiene, cleaning and disinfecting vehicles and other frequently touched surfaces, seating children furthest from driver, and wearing an N95 mask or face mask and eye protection if transporting a child with known or suspected COVID-19. Below are some hyperlinks to fact sheets that were used and guides that were used during this presentation, as well as recommendations for employers. The fact sheets are available in English, Spanish, and French.
Fact sheets. Get more recommendations for employers by visiting the following URLs: https://www.cdc.gov/coronavirus/2019-community/guidance-business-response.html. www.cdc.gov/coronavirus/2019-CoV/2019-HFN-CoV/community/community/transportation/index.html. https://www.cdc.gov/coronavirus/2019-CoV/community/guidance-law-enforcement.html. https://www.cdc.gov/schools-for-childcare/guidance-for-childcare.html. https://www.cdc.gov/coronavirus/2019-CoV/disinfecting-building-facility.html. https://protections-public-health-staff.
More information is available on the CDC, NIOSH, and OSHA pages below. CDC also has a 1-800 number provided at the bottom of the slide you can call for more information.
More information: CDC Interim Guidance for Businesses and Employers to Plan and Respond to Coronavirus Disease 2019. Website: www.cdc.gov/coronavirus/2019-CoV/guidance-business-response.html. CDC Prepare Your Small Business and Workers for the Effects of COVID-19. Website: www.cdc.gov/2019-CoV/community/guidance-small-business.html. NIOSH Workplace Safety and Health Topic. Website: www.cdc.gov/NIOSH/EMRES/2019-NCOV.html. CDC COVID-19. Website: www.cdc.gov/coronavirus/2019-NCOV. OSHA COVID-19. Website: www.osh.gov/SLTC/COVID-19/control-prevention.html. CDC Info. Phone number: 1-800-CDC-INFO. That's 1-800-232-4636. TTY 1-888-232-6348. Website: www.cdc.gov/info.
I'd like to thank everyone for your interest and commitment to keeping your employees safe and stopping the spread of this virus in our community. We're in this together, and together we can make a difference. Ms. Bliss?
Thank you, Jennifer.
You're welcome.
Thank you, Jennifer. That was excellent. Lots of great detailed information and things for staff and employers to consider as we work through this pandemic and figure out how to best continue to serve children and families. Now it's another great pleasure of mine, I'm going to invite Dr. Linda Sager to join me for a conversation on her experience with implementing this guidance in the state of Massachusetts. Dr. Sager is the medical director in Massachusetts with the Massachusetts Department of Children and Families. She's also a professor of pediatrics at the University of Massachusetts Medical School and an executive board member on the Council on Foster Care and Adoption and Kinship Care with the American Academy of Pediatrics. So we're going to get started and ask some questions here. Dr. Sager, throughout the nation, and I believe in Massachusetts as well, child welfare offices are starting to open up again, and states and communities are relaxing their physical distancing restrictions, which of course means that we are going to be having more interactions, more of these in-person interactions with families. Based on your experience, are there still some situations in which these in-person visits should not be occurring?
Hi, Julie. Hi, everyone. It's very exciting to see where everybody is coming from. I just saw McAllen, Texas, and Russell County. So I just want to say how happy I am being here. We in Massachusetts have been very hard hit, as I know many of you have, with COVID-19. I was just going to start with an important point that Jennifer brought up, which is that communication is so essential, and we really, really understood at the outset of the pandemic in early March that we needed a really clear, consistent communication pathway so that we knew what was happening with staff, with foster and kinship families, with children in custody, with youth in congregate care, and with our many open consumer cases. So we developed this tracking form so we know about every situation that related to COVID-19 with all the groups that I was talking about. And we decided that this would be a way to really have a clear pathway. The forms that were distributed throughout the agency were completed by ongoing workers and managers and then sent to me and everyone involved in the situation. And then I responded to each of them by email and sent it back to everyone so that the plan was really crystal clear. We use CDC guidance, of course, and recommendations from our own Department of Public Health. And I think this communication allowed us to quell a lot of anxiety by being transparent about exposure and illness and really clear about what we were going to do about it. We let everyone know we were paying attention and that we would consult reliable sources to make decisions. So this really has worked very well in Massachusetts, and at one point we were getting about 15 to 25 forms a day just related to our own agency. But thankfully the surge has passed in Massachusetts, and we don't get anywhere near as many at this point. But it's really allowed us to really know what is going on throughout the agency with everybody. Early on, we also developed our own guidance about various important topics. We have an amazing policy director, Dimple Patel. Some of you may know her. She took our very primitive writing and put it in readable form. So we developed guidance on many subjects that I know you've probably all been grappling with, like medical visits for children in custody, how to prioritize the initial screening and the comprehensive visit, which we in Massachusetts call the 7 and 30 day, how to deal with COVID-19 positive children or COVID-19 exposed children in foster homes. And of course, we are now, as you all are, working on worker safety, and we're updating that guidance. And finally, like many of you, we've had very frequent meetings by video conferencing. So I think open, clear, transparent communications and protocols really set the stage for our work and helped us deal with this together. So I just want to stress, with anything we're doing, in-person visits, et cetera, there needs to be this clear communication. So the question you asked, Julie, our offices are indeed starting to open up. And one thing we have talked about when we are sending out guidance to our social workers is, what are the situations in which these non-urgent in-person visits should not occur? So Jennifer went over those very well. The first one, of course, is anyone who is COVID-19 positive and is or should be in isolation. Anyone who was COVID-19 positive and has been told by their doctor and nurse that they have recovered and have come out of isolation are okay to participate. This is important because sometimes there's a concern that someone was diagnosed, 6 weeks ago. Do we still have to worry about them? No. But anyone who's COVID-19 now should be in isolation until they have recovered. The second group of people who should not participate, of course, is anyone who is in close contact with someone who is COVID-19 and are now in quarantine for 14 days since that last contact. The third group is obviously anyone displaying symptoms. Jennifer went over all of them: cough, fever greater than 100.4, difficulty breathing, chills, muscle aches, headaches, sore throat, or new loss of taste and smell. They're pretty all-encompassing, these symptoms. So basically what we're saying, anyone who is sick or not feeling well at all should not participate. And then the considerations for high-risk individuals. These are not necessarily a no for the visit, but they're definitely the groups that we need to think about whether they should participate in the visit, and that's anyone over 65, anyone who is immune compromised or on immune suppressing medication, anyone with serious medical conditions such as heart disease, diabetes, chronic lung disease, and finally, pregnant women.
So when these in-person interactions are planned and are going to take place, we talked about some things to do when you are there, but I know that a lot of considerations can come into play in preparing for those visits. So what are some of the things that you have recommended to staff to help them to prepare prior to the visits?
Okay, great question. When I think about preparations, I think about 3 areas: screening, what supplies are needed, and finally, what activities you may want to do. So screening, and again, that's really the most important to start with. That's what we just talked about, those 4 areas of consideration: COVID positive, exposed to COVID, symptoms, and then any considerations for high-risk individuals. So that screening should definitely be done before the visit. I think what we are thinking about in Massachusetts is the day before by telephone or even by video conferencing, but screening should be done the day before the visit. And again, just before the visit. Some people are saying they want to do the screening an hour before the visit, also by telephone. And then others are saying they're going to do it as soon as the visit, right before the visit starts. It's just very hard when you get people together. If there's someone then who can't participate, it's a very difficult thing to cancel the visit at that point. The next thing to consider, of course, is supplies, and Jennifer went over those. What supplies do you need for a visit? You need masks, and, I can't emphasize this enough. Masks are really the PPE, the personal protective equipment that we need and that everybody needs except for the groups that can't wear a mask. Disinfecting wipes, soap and running water if you have it, but given that many of these meetings are going to be taking place outside, there won't be soap and running water there. So hand sanitizer, and then gloves if those are available for you. Thinking about activities, that's another thing to think about. What activities do you want to encourage during visiting time? And then gathering what is needed to participate in these activities that can be done outside and done separately but together, as we say, separately but together. Some of the suggestions I've heard, I think the guidance from one of the New England states talked about examples with young kids, drawing with sidewalk chalk, doing a puzzle while only one person touches the pieces, coloring together with separate books. But I know you'll think about that and figure out how to be creative and do things separately but together. Given the importance of masks, I just wanted to talk a little bit about them. Jennifer talked about cloth masks, and those are great. She gave you all the issues about cloth masks and the fact that they should be laundered after every use, et cetera, and fit comfortably against the side of your face and be secured with loops or ties. But those of you who've used them know that the loops are really far easier to use than the ties. We also, in our agency, use the disposable so-called surgical masks, which are the paper masks, the commercial mask, and we have been able to secure a supply. So if you have them, they'll just fine to use in this situation. If you don't, cloth masks are fine. I mean, actually, they're both just fine to use. In terms of how to use surgical masks, we've been asked that question. Those of you who've used them know, but the basic thing is the surgical paper masks have a stiff piece right over the nose, so you just pinch it to conform to your nose, and it's quite comfortable. And of course, they're disposable, so throw them away after every use. Wash your hands. Of course, you've heard that already 5 times, and you'll hear it 5 more times. Children's masks, of course, recommended for kids 2 and up. So we hope the kids 2 and up can wear them. Some won't. We know we have some youth with behavioral issues and physical sensitivities, and, kids who are just plain scared of them. So we have to be aware of that. And I think most agencies have agreed that if the child won't wear a mask, it's not a reason to cancel the visit, but everybody else has to wear one. I just read an article that said 1% of kids have maskophobia. I know that sounds like a made-up word, but it turns out that young kids just don't have the ability to recognize and read faces. So that ability starts around age 6 and it develops fully in your teens. So just thinking about if this is going to happen, if in a video visit prior to the in-person visit, you or the parents can wear a mask and pull it up and take it down several times during the virtual visit so they sort of see and kind of get used to it. And the last picture on this slide is a person wearing a mask with a window. I don't know if you've ever seen one. They're not widely available. They are available online, and of course they're helpful for people who are deaf or hard of hearing who are able to read lips. So for someone who is talking to someone who is deaf or hard of hearing, having this kind of mask can be useful. So, okay.
Great. That was excellent information. Thank you, Dr. Sager. I know earlier you, even talking about the preparation and the occurrence of the visit, mentioned outdoors and being outdoors. What are some considerations that should be given to the location of the meeting or the visit?
Right. I like this picture because they're sort of physically distant, aren't they? I think all of us who are thinking about visits now are thinking about doing them outdoors. And, if anything is lucky in this whole time, it's that summer is coming, and so we'll have more warm and sunny days, or at least not rainy days, where we can start our in-person visits outside. So, yes, we are saying that outside is absolutely ideal. But some visits will have to occur inside. And so, as Jennifer had said, everyone will do their best to clean and disinfect before and after the visit. All surfaces, tables, chairs, electronic devices, door handles, and handrails. As she mentioned, books probably aren't necessary. Toys, however, they're best, of course, if they are brought in clean. I think in many places we are asking foster parents parents who are coming to visit to bring in these clean toys and that they be cleaned after the visit. That's not always the case, but that can happen. So sometimes you'll be bringing in the toys, but best to have ones that can be cleaned. They talk about sort of hard plastic ones, but stuffed animals that can be washed, anything that can be washed is also okay.
Great. That is, I know, very helpful because there's so much to consider with this. That being said, Jennifer did a great job earlier outlining so many things to consider as it relates to transportation. And just wanted to hear from you based on your experience and questions and possible concerns from the field. What are some other considerations or just the things related to the implementation of that guidance that you may also suggest related to transporting children?
Yeah, I think Jennifer said it all. Again, everyone should wear masks who can, wash hands before and after, clean and disinfect seats, handles, etc. Children should be in the back seat, and we always talk about on opposite sides from the driver. But I think there are situations where you're going to be taking more than one child, and so there'll be a child behind you. Probably best if there are not more than 2 children in the car. We talk about having the windows slightly open if the weather permits. Consumer Reports just had a little blurb about how to clean car seats, take out the removable pad, spot clean the harness and latch straps, use warm water on buckles and latch connectors, and then wash down the hard plastic shell with damp cloth and cleanser. So, when you have a wriggly 18-month-old or 2-month-old, I understand that it is not easy. That's why masks are really, really important for you or for anyone transporting those kids in this situation.
Great, thank you. So I know I am a mother of 2 small children, and being around little kids, it's really hard to explain physical distance to them and getting them to maintain that. So recognizing its importance, of course, how do you suggest ensuring these restrictions with young children, or even I know in many circumstances now parents are able to have in-person contact with their children and haven't been able to do that for quite some time. Is there anything that you may be able to talk about for our participants related to this?
Yes, that's really important. And this is one of the most difficult topics, and I think a lot of us are wrestling with this. And so we in Massachusetts are really thinking about what our guidance was going to be, because we have to acknowledge that this is really difficult to enforce for the entire visit. We want to support parents, comforting and showing affection to their kids. They haven't seen their kids. The kids haven't seen their parents. So how can we be as safe as possible and yet be realistic? So in the interest of risk reduction, we are really talking about what we should try to absolutely avoid and what may be what we can compromise with. And so this slide here shows two situations which we think we would like to urge you to avoid. And I'm glad to see in both these situations that people are wearing masks, but still we definitely should try to avoid face-to-face contact and cheek-to-cheek contact. So these are cartoons that help visualize what we'd like to avoid. But if you want to show the next slide, Julie. So these are two slides. This is a slide of two situations that reduce risk. And I want to be sure to say that it doesn't totally take away risk, but it's something to think about knowing that these situations are going to come up. And in the first people, they have their faces turned away from each other as much as possible. And then in the other one, and actually I think this has already been written into the Massachusetts guidance, small children can hug legs. So we recognize that contact may be unavoidable and inevitable, and we are suggesting please keep this close contact under 15 minutes if possible. Always wear your mask. We're always going to recommend physical distancing, but it's probably a good idea to think about how you will handle it when children are upset and want to be comforted by their parents. And we know parents want to have they want to have loving contact, however brief, with their kids.
So I know we're starting to get a little short on time here, but I did want to ask, I know Jennifer talked a little bit about this, but I know that there are some nuances in how it's applied in practice and by employers. So if a worker were to become COVID-19 positive, what's a time frame when workers have been able to come out of isolation and go back to work? And also, what are your procedures when a worker is exposed to someone who is COVID-19 positive, and just kind of thinking that through a little bit?
Sure, and I'll do this briefly because Jennifer did go over it. If you're exposed to a COVID-19 positive person, the number one recommendation is to quarantine at home for 14 days. I know there have been some different considerations for people who are first responders and emergency response workers. But in all other situations, the recommendation is to quarantine. The one thing I'll bring up that has come up in our agency a lot, because in Massachusetts, the recommendation is to test anyone who's exposed because they want to do contact tracing and know where everyone is. If you're exposed and you're tested and you're negative, on day 2 you're negative, on day 4 you're negative, on day 9 you're negative, the recommendations are you still need to be in quarantine for 14 days because you may be incubating the virus. You could get sick anytime until day 14. So a negative test while in quarantine, unfortunately, does not mean that you can come out of quarantine. In terms of if you are actually COVID-19, when can I come out of isolation and go back to work? And Jennifer talked about the symptom-based strategies and the test-based strategies. And they're also, given that we have so many people who are asymptomatic, there's a time-based strategy. So with symptom-based, you have to have a decrease in symptoms and 3 days fever-free and 10 days have passed. With asymptomatic, it's just 10 days have passed since the date of your test and you've not developed symptoms. The test-based strategy in both cases is that 10 days have had to have passed, and you need 2 negative tests 24 hours apart. I will say, because I think a lot of agencies are struggling with this, we've decided in our agency that we are going to use symptom-based and time-based. We are not going to use test-based except for immune-suppressed people, because we know that people can remain COVID-19 positive. We say 6 to 8 weeks. We're not sure that it's not longer. All the studies are pointing to the fact that you're not contagious after that time. So we have gone to using symptom-based and test-based, symptom-based and time-based, and we do not use test-based for our employees to come back to work.
Great. Thank you. I know we just have a couple of minutes left, and I do want to try to answer a few questions, but I know this next piece is just so critical to everything that is going on right now. And what are some recommendations that you have about how workers could stay well emotionally in this current environment?
So the most important thing is to acknowledge and accept what a difficult and anxiety-filled time this is for us. The pandemic and that economic insecurity, our recent issues, they are not recent, but the recent acknowledgement of racial injustice. And we've all been told to stay at home for months, and now we're being asked to go out and to be in other people's spaces. So if we're feeling scared and nervous, it is completely understandable. I can't emphasize enough the importance of connection to others at this time, friends, family, colleagues from work. It's why I've never liked the term social distancing. In our agency, we talk about physical distancing with strong social connection. And we all acknowledge it's really hard to do. We can't just walk over to someone's cubicle and have a chat. But it's why all the Zoom meetings have been important, exhausting as they are, being on Zoom all day long. So we all need to figure out ways we can be supported and nurtured through this time. So in ending, Julie, and all of you, I just so appreciate being able to speak to you. Please try to be kind to yourself and others. Try to be calm, but understand it's okay to be concerned and worried and looking for clear and concrete guidance about next steps. That's so important. And most important, please be safe. Thank you.
Thank you. Thank you, Dr. Sager. That was excellent. That was really great. I'm not going to go through these because I know we're at time. I just wanted to acknowledge and remind everyone again that underneath the chat box there are some downloadable files. It includes the PowerPoint, and there are select resources in there. Another piece of this is the crucial self-care in the coronavirus crisis.
Resources. Crucial Self-Care in the Coronavirus Crisis. Website, https://www.socialworker.com/feature-articles/self-care/crucial-self-care-coronavirus-crisis. Interim CDC guidance on handling non-COVID-19 public health activities that require face-to-face interaction with clients in the clinic and field in the current COVID-19 pandemic. Website, https://www.cdc.gov/coronavirus/2019-HCP/NON-COVID-19-client-interaction.html. Children's Bureau COVID-19 resources. Website, https://www.acf.hhs.gov/cb/resource/COVID-19-resources. Child Welfare Information Gateway. Website, www.childwelfare.org. National Child Welfare Workforce Institute. Website www.nccwi.org. Please see downloads for additional information on resources.
I do I recognize there are some questions in there. One of the things that I'm going to just note is there was a question related to congregate care settings or settings with more a certain number of residents. And there is a webinar that I will see if we can include the link that has occurred through our administration with Children, Youth, and Families and the CDC that focuses on congregate care or larger residential settings that would provide better information on that. And I do apologize. There's so much great information that Jennifer and Dr. Sager had to share today that, but we did record your questions, and this is also a way to help inform us how we can continue to support the great work that you're doing and get information and resources out to the field. So I apologize that we aren't able to do more of that right now, but unfortunately we are at time, and hopefully you found this to be helpful. We will be sending out information on the link to access the recording for those of you who may want to look through it again, as well as the resources. And please also share it with your colleagues, because we know that there was great interest in this webinar, and a number of people were not able to register. So we will certainly get that recording out to you as soon as we are able. Thank you all for your participation, and I especially want to thank Jennifer E. Lincoln with the CDC and Dr. Linda Sager. This was wonderful, very valuable information that is really going to help the field. So thank you all, and I wish you a great day.